All right, I think we're going to get started. Thank you guys so much for joining our session this morning. I'm going to run through some of the logistics and then I'll pass it over to our panel. My name is Caitlin McNamara. I work for the Wisconsin Board for People with Developmental Disabilities. I do a lot of peer education, peer rights work, but I also get to work with these lovely folks a little bit. This is the second year that we've put this kind of panel together and had some conversation around how we all can work together to make the most of working with our fiscal employer agents. So I'm going to run through just a little bit of the logistics for how this will work. And then we will turn it over to our panelists to introduce themselves and they'll talk a little bit and we'll ask some questions and keep it going until the end of the session. A couple of things we wanted to make sure that everyone knew before we got started was this is not all of the FEAs that exist in Wisconsin. These are really incredible experts in this field who've been working and doing this for a long time. They represent the 4 FEAs that currently serve IRIS members, but there are also some additional ones who serve family care. We're going to have a fairly general conversation today about ways that you can build this relationship, but we wanted to make sure that you knew that this was not the totality of fiscal employer agents in Wisconsin. The other thing that we wanted to just address right up at the front, and something that we think is maybe going to come up, is there's been some conversations and some changes that may be coming down the road, in particular with IRIS and FEAs. But for the time being, all 4 of these organizations still serve people in Wisconsin. And we have some time before changes may be implemented. And we think all of the things that we're going to talk about today are relevant, regardless of who your FEA is and what might be coming down the pike in the future. So we are going to try to make this as a little bit interactive today and gather all of your information and questions along the way so that we can ask our panelists towards the end. We've got a couple of ways that you can help make this session more interactive. There's sheets on your table that have the QR code on them. Otherwise, you can scan the screen up here if you're able to, or you can write down your thoughts on either that sheet there or the sheets that have been set out by the Kalahari. And we'll take a little bit of time now where you guys can submit those questions. I'll collect those sheets as we go. If you have a thought that you have later on and you want to just bring it up to me, that's totally fine. That way we can kind of group your questions and responses together and share those back with the panelists, and we can keep the conversation going. So I'm going to give everyone about 5 minutes, a little less than 5 minutes, to let me know if there's questions with the tech, write your questions down, bring them up to me, any of those things.
Good morning, everybody. Still morning, I think. Good morning, everybody. My name is Emily Llewellyn. I'm the Director of Operations with GT Independence. We are happy to be here at the Self-Determination Conference talking about self-direction and how as a fiscal management service, we support the self-directed arrangement. A little bit about GT Independence. We were established in 2004. We currently serve 18 states and the District of Columbia. We have had a long partnership with Wisconsin. We value investing in our own technology and believe it's important to own and drive those technological advances in the self-directed arrangement as a support to that. We built our own enrollment software called GT Enroll. It's similar, if you are familiar, to TurboTax. Kind of walks you through step by step what's needed during the enrollment process to help eliminate any barriers or confusion during the enrollment process. We also built our own back-end signing software. It's called Initial, similar to DocuSign. And that allows us to own that technology too and make any needs or changes as we grow or adapt our needs. We also have a robust vendor portal reporting where an individual who's self-directing with us can go in and check their spending at any time. It allows clear visibility into spending reports and budget reporting. We also believe that it's important that not having a caregiver should not be a barrier to self-directing. So we have a robust caregiver link that is that we use to help connect individuals that are wanting to self-direct in the care in the self-directed arrangement with a caregiver. We don't want that to be a barrier. I don't want to take up too much time, so I'm going to pass it to Rachel too.
Hi, good morning, everybody. My name is Rachel Messenger. I'm the director at iLife. iLife was founded in 1988. We are based out of Milwaukee, Wisconsin, but we serve both the states of Wisconsin and North Carolina. We serve Iris, Family Care, CLTS, and we've worked with Wraparound and CCOP in the past as well. We're really excited to speak to you today about how we can better serve our self-directed programs and ways that we can help support your journey. We do also provide representative payee services for several organizations as well. So the way I wanted to present about how iLife can better work with you is kind of talking through your journey as a participant, a worker, or a vendor with iLife. And I did want to share too, although we do serve those other programs, this will be more specific to Iris, but if you're with a different program, if you want to come see us at our booth afterwards, we'd love to speak with you. So when working with an FEA, how you'll do that in the IRIS program is you'll work with the ADRC to pick both your ICA, your IRIS consultant agency, and then an FEA. Within the FEA choice, you'll be given a scorecard that tells you pretty much, what the ratings are, past participant experiences, and then also the different ways that we accept timesheets and electronic visit verification, or EVV. So what we recommend is to take a close look at that information and figure out the setup that works best for you. And that's why it's great we have choices here so you can pick the one that you like the most. When you do select an FEA, when you work with iLife, a couple of things we recommend when you start that onboarding or enrollment process is to look at our website and work with your IRIS consultant agent to get what we call a sample packet. So a lot of the forms you're filling out are state or federal forms, which can be somewhat complex. And what we do is we break down in plain language what's needed on the form, what fields are required. And that's helpful because we also recommend taking time to do a double check of your information before you send it to us, because sometimes if a signature date or signature line is missing, we'll have to send it back, and that can add a little time to the process. So taking 10 extra minutes to do a double check can often save a lot of time. For participants, we recommend knowing your employer identification number, which is also called an EIN. If you're transitioning from a children's program to an adult program, you already have an EIN, so make sure you connect with that program to get it. If you're joining an adult program and this is your first program, you'll actually fill out paperwork where iLife can submit paperwork on your behalf to get that EIN, and then we'll let you know what that is. For workers, we recommend knowing how you want your tax forms done. So as the fiscal employer agent, we can't provide guidance on how to fill it out. We can let you know what fields are required. But if you need more detailed advice, we'd recommend working with the tax advisor. And then also for your banking information, something we recommend is making sure you have a voided check or a letter from your bank. That helps us make sure we get the right number for your direct deposit. And then for providers, I know Vicky's going to provide a little more information on this, but a big push we're doing is to make sure you work with the forward health process that DHS is implementing this year. So something I do want to highlight is that for worker timesheets and even our vendor claims, iLife has both an electronic option and paper option. So whichever one works best for you, we can work with you to get you set up with the right one. If you're currently using paper and you'd like to switch to online, come see us at the booth and we can either get you set up today or we can make an appointment for you to do that as well. Another thing we'd recommend is to become really familiar with the pay schedules and deadlines. And we recommend submitting your timesheet early. So as soon as that pay period ends, submit your timesheet. That gives us a little bit more time for processing. So if we notice something might be missing or incorrect, we can work with you to get that resolved before the deadline. Just some more things I'll highlight. So please make sure you keep your information up to date. If you're a participant, you'll work with your IRIS consultant to keep that information up to date, and then they give that information to us. If you're a worker or a vendor, please work directly with iLife. That's important for a couple reasons. One is we can stay connected with you to give you any updates on the program or anything that's changing with our organization. And the other one is for those budget statements, tax documents, we can make sure they get to the right place as well. And then for support, we offer a number of different options for you to get a hold of us. With self-direction, we feel it's very important to offer as many options as possible so you choose the way that works best for you. We do have self-service information available always at ilife.org. So we have guides, videos, and FAQs. We also have our call center and our live chat. I know I prefer to talk to someone on live chat, but we have both options depending on what you like. We also have an email inbox, which we respond to within 24 hours. And then if you'd like to talk to someone and have a little bit more assistance, we have a role at our organization called a participant liaison, where you can either set up a virtual appointment, or if you're located in Milwaukee, you can come to our office and set up an appointment there. Thank you.
Thank you, Rachel, and thank you, Emily. And Rachel did a phenomenal job just now explaining the whole process. So that is awesome. We're done. Everybody go. No, no, you did very well. Thank you. And that process is pretty much mirrored through all of the fiscals as far as the payroll schedule, especially with the IRIS program. There is a payroll schedule that we all follow. So I am Vicki Gunderson. I'm the executive director with Acumen Fiscal Agent. Formerly, they were known as Outreach. So if you had ever heard of Outreach Health, they changed to Acumen a few years back. Acumen was founded in 1995 by some human service leaders that were very interested in providing more efficient, more seamless processes and making this process for self-direction just easier for families, because we know daily lives are very busy to begin with. So, this paperwork can be very time consuming if you're not understanding what you're doing. So my recommendation is always, really understand what self-direction is about and taking the time to understand what it is that you're signing so that you know what your responsibilities are, because you can really be successful self-directing. But sometimes, if you've signed a form and you really didn't understand it, it can come back to haunt you. And that can be anybody's daily life, So just take the time to really be educated on what self-direction is, what your responsibilities are, either as the worker or the person receiving the services. Acumen has been in the IRIS program in Wisconsin. However, we are in 33 states. We are in a lot of self-direction waiver programs, but we do a lot with the veterans programs as well. And so we do have a lot of resources to talk to other states and find out other, best practices. As FEAs for the IRIS program, we actually meet on a monthly basis to do best practices so that we do have some standardized processes for everyone. With Acumen, the one thing that I do, if you haven't heard, we are exiting the IRIS program. So we will no longer be one of the choices for a fiscal employer agent by the end of the year. Currently, if you would be going to an ADRC, you receive your scorecard to choose for the IRIS program, we would not be one of your choices. So I'm here because we still are an active FEA and have been. However, we will no longer be. People that were with us have already chosen the FEA that they want to go to. Their choices were Emily with GT and Rachel with iLife. And so that transition is already currently in process. So our last payroll periods will be in December for participant hired workers and for vendors. However, we are not leaving Wisconsin. We will be in the CLTS program. CLTS actually has, CLTS, I should say, is Children's Long-Term Supports. They do have a directory of fiscals that is unique to that waiver program where you can go on their website at DHS, look up the directory for vendors, put in financial management service, and we would be listed there and how to use us. We will also be moving into family care. I have about 15, 16 years of experience in IRAS, family care, not so much children's, but special needs trust, private pay, other things in the state. So we're familiar with these programs and we will be moving into those. So we're not going anywhere. We'll still be around. But if you are currently with Acumen and you have any questions on the transition, anything that, you're questioning on payroll, or you're having some questions that we need to collaborate with GT and iLife, we all four, that is one thing that I can tell you for Wisconsin with all the other states that we work in, we really collaborate well together and we communicate well together. And I'm very proud to say that we're part of that. So we do try to tailor our services. We try to simplify them. We really do try to have a trust with the families that we serve. And part of that trust is communication. Really communicate. If you have a question, call your FEA. If you're calling your care manager or your case manager in family care, or you're calling your IRAS consultant and it's about payroll, you're better off in reality to call your fiscal that you're working with. They're there. They want to help you. I can tell you there's not a one of us sitting up here that doesn't want to pay your workers. That is not our goal. And I know sometimes there are people that feel that way, but it truly is not our goal. We do have rules and regulations through CMS, the Center for Medicaid, our Medicare and Medicaid services. We also have rules that are labor laws. So we have things that we have to follow. We do want to pay your workers. So I think that's all right now that I have to share about Acumen. So we look forward to your questions. I am on the conference committee here. Please let us know how you feel about the conference, because we always want to improve it every year. Lastly, we'll talk about this at the end. I know Rachel mentioned it. We'll talk about the vendor provider management stakeholder at the end here before we finish up today.
Thank you, Vicki. My name is Jonathan Claflin. I'm the Senior Operations Manager with Premier Financial. Premier has been in the IRAS program since 2016. In late 2021, we were bought by Assurance SD. So we actually have a sister company in the state of Wisconsin as well, Lori Knapp Choice. Longer? Slower? Okay, sorry. So we do have and louder. Okay, got it. We do have a sister company in the state of Wisconsin as well. Premier does focus in the state of Wisconsin on the IRAS program. We also do serve about 9 veteran-directed care programs in multiple states. Our sister company, Lori Knapp Choice, does CLTS programs and family care in the state of Wisconsin. So if you have any questions about that, we do have a representative from Lori Knapp Choice here in the room, but you can also come visit us at our table. We do have a participant dashboard as well that all of our participants have access to. On there, they can go and see their timesheets, they can see their budget statements, and they can kind of track where their spending is. We do have the ability for e-timesheets to be submitted, as well as our own EVV system. We did recently go through a transition away from paper timesheets. So when a new worker or participant is coming on with us, we do require an email address. I will say that's probably one of the things that we miss most when onboarding that worker and that participant is the email address. We need to make sure we do have that in our system. I don't know if I said it, I've been working in the IRAS program for 11 years. So like Vicki, I've kind of been around the block, been here for a while, but definitely happy to be here and answer any questions that you guys might have.
Thank you, guys. I have some questions that I think we can move through that we'll talk on more of these topics. And I can see that folks have been asking some questions and giving some feedback in the online and in paper form. So we'll get to those towards the end, don't worry. And I'm trying to incorporate some of your comments and questions into the other questions that we're asking. But I will start with our first question, which some of you have mentioned a little bit, but I figure I'll give each of you a chance to respond to this. But what are some key steps individuals should be taking when they're trying to onboard a new support worker through an FEA? Do you want to start?
I guess, sure. So I think the key thing that I would state is making sure that is, Rachel kind of pointed out as well, making sure that the paperwork is correct, taking those extra 10 minutes to verify that everything is submitted correctly. I know on our website, premier-fms.com, we do have fillable forms. So if you fill out the demographic information on essentially page 1 of the application, it does pre-populate all of that information in the rest of the forms. Good thing that it pre-populates. The negative side to that is if you enter something incorrectly on page 1, it's now incorrect throughout the entire application. So taking the extra, 10 minutes, 10 seconds, whatever you take to verify the information is correct. If the social security number is incorrect when we go to do the social security verification, it will fail and we will have to send that back to either the IC or yourself for updates. So I think, definitely making sure that you're taking the extra bit of time. For all of us, as far as EVV, again, making sure that we have the email address because we do need to enumerate the workers. But from Premier, because we don't do the paper timesheets anymore, it's really making sure that we have an email for both the participant and the worker. As Rachel said as well, updating that participant information, you would need to go to your IRIS consultant. They will update that in the state system, and that will come over to us on an eligibility update file that we receive. I think that's all I have right now.
Well, mirrors what you just said. And again, I'm going to just drive home. Communication is really key. If there's information that we should know in advance, please let us know. An FEA is also going to run background checks on any of your hired workers, whether you're in family care or you're in the IRIS program. So no matter who your FEA is, one of us or outside of us, because there are other FEAs here, they will run that background check. If you know things in advance, I would say share that information because those are the things that are going to create delays. If it's an out-of-state person that you're hiring that moved to Wisconsin, but they lived out of state for several years prior, that background check may take a little bit longer because we have to run an out-of-state background check and sometimes they don't come back as fast. So just, really be transparent. Tell us what your needs are. What is your comfort level? If you're not comfortable completing forms or going through DocuSign or GT Enroll or some of these, if you're not comfortable, say it. Somebody who's more than willing to help you in any one of these FEAs that are sitting here and the others that are out in the exhibit hall. So really communicate, I need some help. I maybe don't read as well as I wish I could. And anybody here would be willing to help to make sure that it gets completed the first time. That is usually what creates the delays is incomplete paperwork. I hear often that, it took several weeks or a month or more. And if we can help you make sure that it's complete the first time through, it's going to move things along a lot faster. If you are hiring a worker, make sure that you're letting them know that FEA is going to be asking you for information. They're going to have an I-9 form that I need to, as your participant that you're going to serve me, I need to be able to verify that you're eligible to work here. Make sure that you have a valid driver's license or identification or a passport that's not expired. We can't accept expired documents. So just preparation will really help move things along.
All right, so Jonathan and Vicky did a great job of explaining a lot of things that I had in my notes as well, but a few things I'll add. We actually had someone who let us know at our booth yesterday that in the IRIS program, they updated the background check policy, which is an amazing change in the program, but there are some changes for how we'll be communicating with the participant and the worker. So with the change, we will actually be sending letters with the findings and the decision on whether that person has passed or not. And those are great letters. We worked in collaboration with DHS to make sure that once you get the letter, you know fully what the decision is, what your options are, and why that decision was made. If you're not familiar already with the DHS IRIS website, that is something that you can have as a tool in your tool belt when working with your worker to explain the policy further if you need. And then lean into your resources, whether that's your IRIS consultant, calling your FEA to better understand something if there's anything we can explain further. And then I'll just emphasize the same points about making sure we have an up-to-date email address and your address itself. And please check your mail. I know I'm someone where I get a lot of junk mail, so sometimes I don't sort through it timely, but there are some communications that were required by the government to send in paper form. So be sure if you see your FEA name on there or DHS that you do check that.
Well, my wonderful partners did a great job of explaining many of the things that I was going to say too. So thank you for that. I would also say as much as we could avoid the correction process in the IRIS program going back and forth, so having correct information from the start, making sure that all of the enrollment paperwork is filled out correctly, that we have all supporting documentation that we need, including guardianship paperwork or power of attorney, if applicable, and then also making sure that we have an email address, as it's crucial now to make sure that individuals are enrolled and enumerated in Forward Health.
Thank you, guys. All right, I'm going to move to our next question. And that is maybe I'm going to move to the next question. Yeah, there we go. What documents or information tend to cause the most confusion during onboarding a new worker or getting started in the with your FEA, and how can people better prepare for that? And maybe can you share a few common administrative or paperwork mistakes? I know everyone's kind of mentioned social security numbers, names, emails, addresses, things like that, but others that you can think of that are pretty common mistakes that people make when they're hiring support workers and how they can avoid them.
Absolutely. A common mistake that we see at GT is if someone does have a guardian or a power of attorney, they're actually entering their information in the participants' portion of the enrollment paperwork. So that automatically would reject a need for correction. So if there is a guardian or a power of attorney, just making sure that they are adding the participants' information into the enrollment documentation. Making sure another common issue we see on the I-9s is making sure that expiration dates are added. That can cause a rejection and cycle the process of needing a correction if we don't have an expiration date added to the I-9 document. Those are our two largest.
Thank you. A few things I'll add. So I'll plug our sample forms again, where they break down in plain language what's needed and what's required. So for the worker paperwork, the W-4 and the W-T-4, that's the federal and tax documents. So again, be careful about reading those instructions and how exactly you want those taxes to be withheld. That is something, if you want to change it over time, you can. If you want to claim exempt, that's a decision you can make. Just making sure you see how and where to put that information. Echoing the I-9, that can be somewhat of a complex form. So is making sure you read the instructions and get all required fields there too. For the relationship form, sometimes the way people fill this out can be a little confusing. So if you're the worker, list who you are to the participant. So we often see people kind of invert this. So for example, if you are the worker for your parents, you would list child on the form. Sometimes people will put parents because they're working for their parent, and then that can cause some confusion, and that does sometimes have tax implications. As we mentioned earlier, for the participant, if you already have an EIN, make sure you have that available, or we'll have paperwork that you'll fill out where we can get one on your behalf, or even call to get it if you don't remember it. And then something else we've noticed is when transitioning from a children's to adult program, once the participant turns 18, the parent can no longer sign for the child unless they are the guardian. And then just to plug for the vendors, the process is changed. Oh, is that okay to take a question?
We're going to save questions to the end, or if you write it down, we can get to it. We'll let the panelists finish and then we'll.
Thank you.
No worries. Thanks.
And just the last thing I'll plug, the vendor onboarding process has changed as well. So we'll talk about that a little bit more in detail at the end, but DHS is taking on a portion of it, but you'll still submit your W-9 and direct deposit information to the FEA.
They have done a very good job, and Emily bringing up and Rachel bringing up the guardian, or if there's a POA involved, is critical. We do need a copy of that process, paperwork. A lot of times what we have found is somebody may have applied to be a POA, but it hasn't actually gone through the system. And so it's not active. And so they'll want to sign on behalf of, say, Jonathan's going to be receiving those services. And I've applied to be his POA, but I'm not active. That does create some confusion. I used to run into that on the family care side a lot, where people would say, well, oh yeah, I'm their POA. They really hadn't became an active POA, so they still couldn't sign on that person's behalf. So that is another reason that we're asking for copies of the guardianship. So that is something else to make sure that you have in advance when you're doing this, so that you are prepared. Being prepared is really the key here. I'll just echo too, the EIN number. If you are coming from a children's waiver, talk to who has been your fiscal there. Ask for that employer identification number. You keep the same employer identification number when you go into the adult waivers, which would be IRIS or family care. So you're not going to need a new one. It's going to be the very same one. It's kind of like when you think of your social security number, you get one. You're going to get one employer identification number. Sometimes people will say, I've never had one. And another good question, did you ever own a business? Or, oh yeah, back 20 years ago, I had, a restaurant. They would have an EIN number. So, and it's trying, and you have to have patience when you call the IRS to get that EIN number. It's a very frustrating process, but an FEA can help prepare you for that, because they're going to ask you some questions too that you're going to want to be prepared after you've been on hold for an hour and a half. That is truly the way that works with the IRS. It's very frustrating, but we'll help you get there. Because we can't apply for a new one. They're just going to deny it, saying you have an existing one. Anything else, Jonathan?
Just a couple things. Rachel touched on the W4, WT4. Just as a reminder, though, if you are filing exempt, those do have to be renewed annually. One of the biggest questions we get is, I did this last year, why do I have to do it again? If you filed exempt, we do require, the government does require that those are renewed annually. So what we do is we will send notification out to the participant, or excuse me, to the worker, letting them know that we do need the W4, WT4 back by a certain date. Otherwise, they will go back to a non-exempt status. Also, one of the things we see missing most on paperwork is on the background check. Right above where you sign, there's a spot for initials. That is probably the worst spot for that to be, because it's skipped over so many times, and that does cause us to send back a good number of applications as well. But that's the only other thing I can think of adding. So
Thank you, guys. All right, just as a reminder, if you have questions that you want to submit, you have other information that you want to fill out as part of our little survey, there are QR codes. I know some people walked in a little bit later. There's QR codes on the tables, or there's forms you can fill out, or you can write it down on the Kalahari paper there. And we will be happy to either, when we get those questions, give them to our panelists here, or save them for the end and give some folks a chance to ask some questions. But we've got a couple others that I have ready to go here. So the next question I have is, how does the FEA ensure that workers are paid accurately and on time? And what should the individuals who are using their FEA services do if there's an issue with their payroll?
So going back to a comment that Rachel made earlier, get your timesheet in as early as possible after the due date, or excuse me, after the pay period ends. There's actually about a week between the end of the pay period and the time that those timesheets are due to the FEA. So getting those in as close to the end of that pay period will help us have more time to review it and make sure that we are paying you timely. With Premier, again, because we are e-timesheets and EVV now, as soon as those timesheets are approved in either CareTime, which is our EVV app, or eTimesheets, which is our eTimesheet portal, those automatically come into our system. So we start running edits on those timesheets right away. The edits are run nightly, so we are reviewing those right away to ensure that they are correct and accurate. Oh, and as Vicky said before, we want to pay your workers. We're not trying to not pay them for the services that they're doing for you.
So, in addition to what Jonathan said, we do want to pay the workers, and having someone that is actually verifying, confirming those hours that are paid. So take the time, if you are the participant that is receiving the services or the member that's receiving the services, that is one of your roles as being in a self-directed program to be responsible for confirming the hours that have been worked. So I've told people, if you need some assistance or need a tool, take a calendar and just write, on Monday, Jonathan came and he worked 3 hours. You don't have to even write the time, just put 3 hours. So that at the end of the week or the end of that payroll period, you can add up those hours and the dates that he worked and just have something to verify it. It gets complicated. Days can run into each other and you're trying to say, oh, when I'm going to sign off on this, did he work today or didn't he work? Or how many days did he work? Some of our systems have the option to sign off later at the end of a payroll period. Some people like to sign off after you've worked every shift, but maybe you're asleep. And so, we don't want to wake you as the worker. So you have a way of some way confirming the hours that have been worked, because that is the responsibility of the person receiving the services, is to sign off and confirm those hours. You are the employer of record. So like our employers that we all work for, they're going to pay us, but there's somebody that's going to confirm the hours that you've worked. So make sure that you're signing off and confirming them and just not signing, not really verifying. I think that's really important. It keeps the myth that there's so much fraud in this, that we know it's a very small percent. Other than that, I know the question said, and who to contact. Make sure you're contacting the FEA. If you're contacting your IC, IRIS consultant, or you're contacting your care team, they're going to ask you to contact us. We're the ones that are doing the processing. If there's an issue, we really do want to help you through it. The sooner that you contact us, the better. Really encouraging that they send their timesheet. We don't accept paper timesheets either, but sending in and submitting their time timely, not 3 months later, not 4 months or 6 months. Oh, it's my second job, I'll just send it in, down the way. It's very beneficial to send it in timely.
All right, thank you. So a few things I'll add from the IOLIFE lens. So we really recommend being proactive and getting to know your timesheet, whether you're using the electronic portal or the paper timesheet option. It can feel a little bit complex and overwhelming at first. So we have a couple of different ways that you can get that information and one-on-one help if you would like. So one is that we host monthly on-site events in Milwaukee, and once in a while we'll do kind of a statewide tour and send out information when we're going to hold an in-person event in Wisconsin in your area. We also have the option to set up those virtual appointments with a participant liaison. Those are really nice because that's not
calling into a call center and potentially waiting a little bit, this is a time that you select that you know you're available, and then we have time dedicated and set aside for you as well. If you would like to call us, we do have our call center. We also have the live chat option if you have some questions. And then at our website, we also have some training information and education about how to best fill out your timesheet. If an issue is discovered, so we use robocalls, which I know people are like, robocalls, we hate those. We actually tried to turn them off a couple of years ago, and a lot of people asked for them back. So they're back by popular demand. But what's nice about those is in real time, when we close payroll, we let folks know if something was denied, the basic information about why, or even if there was personal care hours that were cut because they went over authorization. So you have that information right away. What people often do is once they get that information, they'll call us to see what the specific issue was, and then we direct on how to get that corrected if corrections are needed. A couple other steps we recommend is if you notice your pay doesn't match what you were expecting, is to take a second look at that timesheet. A common error we see is sometimes people will select PM instead of AM. And so then what you would do, like, or you miss a service code or write the wrong one down. If that happens, if you submit a new timesheet, write corrected on the top of it, just because we have to deny anything that looks like a duplicate because we don't want to overspend. But that corrected will let us know to get that looked at and get the adjustment over to you. So again, if a payment is wrong, please get a hold of us. And then sometimes we have to collaborate with the IRIS consultant if something didn't come over from an authorization. So that communication is key so we can get you paid timely.
Thank you. I think those are all great pointers. I would also say just in the self-directed arrangement and being the employer of record, understanding the program, the rules, the payroll schedule, as everyone outlined, knowing when timesheets are due, and making sure that they're submitted timely. Both the GT portal and app would let you know once timesheets are received to GT, and then also if something is kicked back and needing correction as well and needing action on with either an action needed to update the time entry. But just really kind of understanding and owning the payroll schedule and knowing when things are due and making sure things are your time worked is submitted timely to be paid timely.
Thank you, guys. All right, the next question that we have is really kind of one of the fundamentals of what we are talking about here in a session called You're the Boss. How can working with an FEA support an individual's right to self-direction and control over their services?
It's a great question, fully loaded. I think an FEA really should be the biggest supporter of the self-directed arrangement. We're ready for you to be the boss, and we're ready to help facilitate that. That's our job. Our job is to help facilitate any individual self-directing being the boss. And that comes through empowerment of understanding the program, the rules, your services authorized, how they're authorized, understanding your needs and working with your authorization, understanding budgeting and reporting available to you. We have a robust reporting suite within our portal that allows an individual that's self-directing to truly monitor, engage their spending and their utilization. So just owning that arrangement, owning your services, and asking questions when you have questions. It's vital to make sure that all of your questions are answered in the self-directed arrangement.
And what I'll add to that is iLife has proudly been a part of the IRIS program since the beginning, and we work in several other programs. And some common themes that we see is we really want to be someone that you don't think about because we do our job so well. We do the paperwork processing, we issue your payroll, we issue your taxes. We want you to have that happen so seamlessly so you can focus on scheduling your workers, making any changes you need to, and working on your care plan. So we want to do our job so well, you don't think about us. But if you do, and you need to call us, making sure you understand your options. So that's why we offer so many different ways for you to get a hold of us, from our website, call center, live chat, or even those one-on-one appointments.
Thank you, Bo. The other thing that I will add to that, and I tell people this often, is when you think of your fiscal employer agent, think of them as an extra layer of support. So we are there in an administrative role. So when you think of a work environment, you have your HR, your human resource services. Think of us as that role. We're that part of the job. We aren't there to do the hiring and the firing. But if you are having issues, think of us as an extra layer of support. We can provide some resources to help you. We can collaborate with your team, whether it's an IRIS consultant or a care management team. We can help collaborate with them to help you. We know those can be stressful situations, especially if it's a family member or a friend that you've hired and things aren't working out. So really think of us as that extra layer of support.
Yeah, and just to add on to what Vicky said, we work for you as well. We don't come out of your budget, but we work for you. You guys tell us what to do. So
Thank you. Okay. In what ways can families or individuals collaborate most effectively with their FEA to make that process smoother and less stressful? I know all of you are talking about different ways to collaborate already, but what are the key things that folks should be thinking about that will make this relationship stronger?
So it's been a running theme through the entire presentation, but communication. I want to hear from you guys what we're doing well, what we're not doing well. We have what we call collaboratives. We do them 3 times a year, and we're always looking for more people to join those. So if you have Premier as your FEA and you want to join that collaborative, please let me know, and I can get you guys hooked up with the next one. We did just finish our last one for this year, but we will have one probably February, March of 2026. But we really want to hear from you guys because we can, sit and make changes to our process to how we, look at timesheets, whatever. But if it's going to make it more difficult for you, I don't know that we want to do that, right? We want to know what is going to best serve you guys, what you guys will get out of the situation. So for Premier, it's really, just communicating with us and letting us know how we're doing, providing those suggestions for improvement. And if you want to join our collaborative, stop by our table in the exhibit booth and we'll get your information down and get you added to our next one.
Thank you, Jonathan. And I know this was brought up, I believe, by Rachel, making the time, taking the time. We know it's really important, and I know it's hard if you're calling your FEA and having to leave a message, and then they call you back and you're in the middle of, transferring or feeding or doing something like that. When you are communicating, tell us what's the best time to call you back. Not just call me back, but I'm going to be available at this time. And if you aren't, we can try again. But really communicating what works for you and your schedule, because for many people, if you're the care provider or someone, you're calling about your timesheet or something, call us and tell us in that message, when is the best time for you? Really understanding the roles is really important. I hear people all the time say, I work for Acumen or I work for one of the other FEAs. You're working for the person you're providing services for. They're the employer of record. We're here as that extra level of support. We are not who you're really working for. We do process the payroll. So really understanding those roles are super key.
All right, and then piggybacking on the communication theme. So be in good communication with not only your FEA, but also your ICA. We work closely with them to make sure that we deliver your care plan effectively. And with that, something that we noticed too is just make sure that we know who your guardians and POAs are, that we have all the documentation on hand. So we have to protect information. With HIPAA, we can't just give out information to anybody who calls. So if there's someone who can call on your behalf, if we have that in our system, we can provide that information quicker. Otherwise, we have to take a few additional steps before we can provide that to someone else. And stay in communication with your entire care team. Some participants will have multiple workers, and I've been really impressed by seeing, the binders, the notebooks, apps that people use to make sure that they keep everyone up to date. So sometimes when we call, we'll have quite a long call with someone just so we can make sure we walk through each of the situations that they're working through with their workers, and we can get everybody where they need to be with our services. And then just another plug to make sure you keep your contact information up to date with us so we can stay in contact with you and let you know what changes are coming.
Thank you. Also echoing communication is key. It's a two-way street. It's important that we know how to reach you and you know how to reach us, and that you reach us early and often if you have questions. Also, a tip that we like to share with our stakeholders at GT is save our customer service number in your phone. Oftentimes now our cell phone carriers automatically can send a number to voicemail if it's not recognized. And that's a setting sometimes that individuals don't even put on their phones, and it just happens on the back end. So we recommend saving your contact number to your FEA in your phone so that it helps streamline that communication with us.
Great. I think communication is also the biggest like theme of the questions and the comments that have been submitted. I think it's just all over this. So if you guys don't mind, will you just run through again when, where, and how to get in contact with your FEA? So what time of days can you get in contact with an FEA? How should they be finding you? And when should they be reaching out?
Get in contact with us anytime you have a question. You can contact us through our website. You can contact us through our customer support line. Our phone support is open Monday through Friday, 7 a.m. to 6 p.m. We are here to answer any of your questions. You can message us through your portal. You can email us directly as well and receive customer support that way, early and often.
All right, with iLife, we have our website, ilife.org. So there's information available to you at all times if you'd like to look and access that there. We also have a call center and live chat. Live chat's also found at ilife.org. Those are available from 8 a.m. to 5 p.m. Monday through Friday. We also have an inbox, iris@ilife.org. If you write us there at any time, we'll get back to you within one business day. And then we also have regular on-site events once a month where you can come to Milwaukee. Otherwise, we have virtual appointments that you can set up with our participant liaisons during Monday through Friday as well. And that's where you can select a time and date that works best for you.
For Acumen, we have a call center that is available 24 hours, 7 days a week. There's Christmas that there's not anybody, but otherwise it's staffed on holidays as well. And then you do have what we call our agent model at Acumen, which means that you have a direct person that you report to. So you'll be provided in your welcome once you're signed up with Acumen. You would be provided the name, direct email address, and direct phone number to that person. Again, we have the 24/7 if you're trying to submit time. We don't allow paper timesheets, so we do have an app that is Acumen, proprietary to Acumen. They created it. And so if you're having issues sending something in, or your app's not working correctly and it's Saturday evening, you can call the 24/7 through the week. Otherwise, you can call your agent and they would be able to get back to you if you have to leave a message. Most agents try to get back within a couple hours, but no more than 24. What else? Oh, we have a website and we have email as options. If you're with Acumen, you have access to our portal. So there's multiple ways to get in touch with people, but the agent model is really the best so that you're contacting the same person all the time.
At Premier, our phones are staffed from 7 to 5:30, Monday through Friday. We are open for walk-in visitors Monday through Thursday. We don't have walk-in visitors on Fridays anymore. Email iris@premier-fms.org.com is our email address. So feel free to send us an email there. Otherwise, feel free to come visit us. We're located at 10425 West North Ave in Milwaukee, right across from Wauwatosa, or in Wauwatosa, right across from Mayfair Mall. So if you come visit us and want to go shopping, let me know. I'll go shop with you.
All right, thank you guys for that. And thanks for the questions coming from the audience as well. The next question that we wanted to ask you guys is, can you share a real world example of somebody who, without sharing information that is inappropriate to share, when someone overcame an administrative challenge with the support of an FEA and what that process looked like?
So I think in the history of the IRIS program, there's many. Going back to many moons ago, we went from a semi-monthly payroll to a bi-weekly payroll, which was a huge challenge. DHS mandated direct deposit instead of paper checks, so that was a change. So there's been many. EVV obviously is, probably the most recent one. Personally, with us at Premier, I know that we, have had some participants who have had issues with onboarding, with not getting information over to us if it was through a transfer or just a new applicant that they're hiring. And I give out my personal line, and some people even get my cell phone number if the issue is enough. So they will call me and talk with me, and I will kind of handhold everything through the process to make sure it gets through the process. So as I stated before, we work for you, and whenever we bring on a new staff member, I try and help them understand that you guys are the participants. You are the people we work for. So, I look at you guys as my boss as well. So you guys can tell me if I'm doing good or not, and we'll make improvements. So.
With this question, when we were talking before the presentation, I couldn't think of anything really directly related to one situation. So when I think of this, I think one of the main things that we overcome on a pretty regular basis is people using the app to sign in, sign out, technology. I'm not great with technology, so I can appreciate that. And our agents do put on their signature that people can schedule at any given time a virtual meeting with them, and they will do a training individually with someone. So I have participated in some of those virtual meetings where they'll help somebody that maybe just they keep working and they're not submitting their time because they're just not sure or comfortable at what level they have technology skills. So our agents have helped many people through that process of getting their time submitted, which is, we work for a reason, to get paid, to pay our bills. So that is very important. So if people are challenged with that and they're not getting their time submitted and holding back, then there's frustration. And then that rolls into, their work that they're doing with their person. And so we want to make sure that we can do that timely. So our agents will do all the training for our DCI app is what it's called. So hopefully we can do that in a very timely manner to help people. But I think that and the dreaded EVV, electronic visit verification, that happened, that is not Wisconsin driven. It is a federal mandate. Those are all things that we've worked people through that have had some struggles.
All right, so I have a story of a situation that actually happened this past winter, which I keep thinking is much sooner than it was, but we're actually entering the new winter soon. But we had a situation where someone came to our Milwaukee office as a walk-in and said, I need to close on a home today. I didn't save my pay statements. I need an employment verification letter. They need this information so they can verify I have the income to purchase a home. So we had our participant liaison team work with this person to make sure we understood exactly what they needed and got that information to them that same day so they could go and close on that home. So that's something else that we do is often workers will need to say, I need to verify that I work here for different benefits, purchase a home or a car, and that's something that your FEA can do for that worker as well.
Thank you. Those are all great examples. Recently, we had a situation where a participant was transitioning to GT Independence, and this individual was visually impaired and having some complications with EVV and the app. So we had some team members jump on a call with him and his caregiver to make sure that he felt fully supported and comfortable in submitting and in his PHW submitting and his approving time worked. And it was very important that he felt comfortable in understanding how to do that. So we took some time to do that and are happy to do so to make sure that anybody feels empowered as the employer of record when submitting time.
Thank you, guys. I'm seeing some of the additional questions come in, and I think EVV is coming up quite a lot, and technology is kind of the other thing. So if you wouldn't mind just talking a little bit more about, why is this a thing that we're doing, and what are the resources that you guys have available to help people with this technology issue? I know a couple of things were mentioned, but if you wouldn't mind just talking a little bit more about EVV, because it seems to be a concern.
Absolutely. As Vicki mentioned, EVV is not something that the FEAs came up with to make things more challenging in the self-directed arrangement. It is a federal mandate and a way of verifying that certain services are being provided as authorized. So it's important to understand what services are EVV mandated and what the needs are to make sure that those shifts are compliant. We have an app that we built that we use for individuals to track their time. We also have a portal, but it's important that people understand that EVV is a very real thing, and if an EVV compliant shift is not compliant, that can be a barrier.
Yeah, what I'll add to that is so for EVV, it's required for personal care and supportive home care services. Folks who are live-in workers are exempt from this requirement. So if you have a live-in worker, make sure that your IRIS consultant knows that they have the correct authorization. They should be talking to you about your worker's compliance. So if there's ever a question there, work with them. They can connect with us if anything needs to be updated. With iLife, we work with the state-provided SAN data provider for EVV. Through them, we have a mobile application. There's also something called telephony, where if you have a landline phone, you can call in with those codes. And the last option is called FVV, or a fixed visit verification, where there's a little device where you can press for a code. This one's most often used when folks don't have access to a smartphone, internet, or a landline. So it's just providing more accessible options for folks if you'd like to meet that EVV requirement.
What I'll add to that is, and I think Jonathan or somebody mentioned it earlier, keep your communication with your FEA if you change your phone line, if you change a phone number, if you are moving or someone moves in, moves out, please make sure that you are sharing that information with your FEA. It's really important because of some of the exemptions that go along with the electronic visit verification. One thing that I mentioned in a session that I was in yesterday was, I know when you see on Facebook these groups and stuff, people are always thinking that because of EVV, they're being tracked everywhere they go. And that's not necessarily the case. You do need to provide the services where you're at with that participant. You can't be saying you're putting them to bed, and yet when you're clocking out, you are 20 miles away. That is why EVV came into existence too, is just to avoid and have a little bit more accountability. We are not here to, as a FEA, to sit there and monitor every move that you make. That's, again, not our role. But I do know that that is a myth that is out there, is that we're tracking everybody everywhere they go, and we're not. So just really understanding EVV is not an FEA directive. It is something that we are mandated to do through the feds.
And with Premier, we do have videos on our website as to how to use our CareTime app. We also have the fixed device. We have the mobile app as well. So it's really staying in communication, as Vicki said, making sure information is up to date. And yeah, we're not the ones who are implementing this. This is a federal mandate. Also with vendors, it's very important that vendors, if they don't have an EVV visit and they're providing supportive home care, we do have to deny that service. We cannot pay a vendor if there's not a verified visit. The workers we can pay without a verified visit, but we are required to report to the IRIS consulting agencies what the utilization of that is, and like we're not utilization, compliance. Thank you. So, you know, we do report compliance numbers to the ICAs on a week, per payroll basis. So every other week we send those reports out.
Thank you. There's a quick question, I think mostly for Rachel on what is a participant liaison?
So a participant liaison, it's kind of like it's somewhat like a customer service agent, but it's someone who, instead of waiting on a call center for people to call in, they are someone where you can set up an appointment, and they are well versed in the IRIS program. So they know everything from what it takes to be onboarded through submitting a timesheet to what if you need to update your tax information. So this is someone where they will set aside, I think typically appointments are about a half hour, where they can answer any question that you'd like, and then they'll get you connected to someone if you need. So it's a support role at iLife.
Thank you. Okay, yeah, I think there's a question over here. Oh, can you explain what an EIN number is?
Okay. So that's an employer identification number. So one of the cool things about the IRIS program is that you become the employer of record in the eyes of the IRS, which means that they need to have that unique identifier for when when we process payroll and we report taxes on the behalf of the participant.
So if they don't have an EIN from either CLTS or some other business, the FEAs play a role in helping them get that
Yes.
number.
That's correct. So as a part of the onboarding packet for participants, there are certain forms that you'll fill out that give the FEA permission to reach out to the IRS on your behalf. And that's where Vicki was lamenting that we are the ones who will go on hold for you to speak to the IRS and make sure we can get that information. But that is really critical for us. Yes. Yes, good question. So the question was, for the people who work for the participant, do they need an EIN? The answer is no, this is just for the participant. If you do have one, I would check with your FEA, your fiscal.
Yeah.
You're welcome.
Okay, one last question. Oh, maybe I already did this. No, okay, one last question, which we asked both the audience and you guys. So we'll start with you guys, and then I can maybe share some of the things that the audience said. What's one thing you wish People Self-Directing knew before starting the process? And we've just got about 5 minutes, so a quick thought on what would be the one piece of advice.
I think in review of what we've been sharing, it's important to understand when you're self-directing, you are in control. As the employer of record, you are the boss. I think as Vicki stated earlier, we are not the boss. We're the fiscal. We are paying what's authorized based on your care needs. It's important to understand that you get to own and drive where your self-directed arrangement is going based on your needs. And also that it's important to understand the program rules. And I know we hit on this earlier, knowing when timesheets are due to make sure that your workers are paid on time. It's very important to understand the program rules and to have autonomy in being the employer of record.
What I'll add to that is knowing the different support teams available to you. So knowing the difference between all the acronyms, the ADRC, the FEA, the ICA, and DHS, and know that if you come to one of us and it's meant for someone else, that we will help you get to the right spot so you can do your work.
That was pretty much my thoughts on it, is really knowing the roles of each, what the ADRC is, what an FEA is, what the ICA or a managed care organization is, and what everyone's role is is really important. I think it's really important, again, which I said before, and I think we just reiterated that, is understanding that you, as the person receiving the services, are the employer. And if you're the worker that's coming in to help, even if it's a family member, to keep in mind, this is employment. This is a job. It's not a, hey, I'll show up when I want and do your laundry or do the cleaning for your supportive home cares. It is a job and it should be respected as a job.
And the only thing I'll add is to know that you're not alone. There are resources to help you. Us, as Rachel said, your ADRC, your IRIS consultant, your case manager, we're here. So if you have questions, feel free to ask.
And I will say the advice that was submitted on the online system was very similar to what you guys had said as well. And then just echoing again what has been a very consistent theme of this conversation, which is communicate, communicate, communicate. All of these things can be resolved with open communication between the FEA and the employer. I want to thank you guys again so much for doing this. Emily, Rachel, Vicki, and Jonathan have all given so much of their time and their expertise to be able to have this conversation with us. Where can they find you guys if they have more specific questions about their own particular situation here this weekend? And again, we've talked about ways that they can get in contact with you, but if they want to talk to you guys before you leave, where can they find you?
So I think we're all pretty much in the same area out in the vendor hall. I know Vicky's up against the far wall. That whatever way, far wall, we're across, GT is right behind us, and then iLife is right behind them. So we're all kind of like right in a row on the far end of Africa East. So yeah, towards the doors, towards the closer, the not far backs. So
Yeah, so some of us will hang out for a few minutes but I know it's getting to lunchtime. So if you have to go on, go ahead. Yeah.
thank you, everyone.
Oh, yes, the code. Thank you. I've forgotten this almost every time. Okay, the secret word for this breakout session is Wisconsin. It has a capital W just in case, and it is the full word. So just if there's any issue with that. Yeah. Thank you guys. Thanks so much.